Thank you, JP sir, for that excellent and detailed video presentation. Now I invite Dr. Jason sir. He will be talking about idiopathic floppy iris syndrome. He is the consultant cataract surgeon at Jyotis Eye Care Hospital, Kannur.
Good morning. My topic is floppy iris syndrome. Floppy iris syndromes affects patients taking alpha adrenoreceptor antagonists. The incidence is 2% of it affects 2% of cataract surgeries, and the incidence among alpha blocker users is ranging from 33% to 78%. And floppy iris syndrome is a triad of flaccid iris that bilos in response to fluid current, and there is tendency for the iris to prolapse through incision, and there is progressive meiosis. Tamsulosin blocks alpha 1A receptor, and it relaxes the smooth muscle of bladder neck. It relaxes iris dilator as well. This makes conventional dilator drops ineffective. Tamsulosin is not the only drug causing floppy iris syndrome. Other alpha blockers, some beta blockers, some antihypertensives, and some antipsychotics can cause floppy iris syndrome. In this video, you can see viscoelastics can be used as a barrier against floppy iris. The common complications of floppy iris are iris trauma, PCR, and vitreous loss. Pre-operative screening is important. You have to screen both male and female patients. Detailed drug history should be taken. If the post-mydriatic pupil size is less than 6 mm in a patient taking tamsulosin, floppy iris incidence is high. Long-term tamsulosin can cause atrophy of the iris dilator muscle, and this effect can last for years. So stopping tamsulosin before surgery may not be useful in all cases. To prevent iris prolapse, you have to make a triplanar incision. You have to make a slightly longer incision, and paracentesis should be small. This is to prevent iris prolapse through paracentesis. Trypan blue is used to visualize capsule during phaco. Trypan blue makes capsule less elastic so that you can easily do rhexis in a small pupil. Heavy viscoelastics reduce floppy iris. You can even do viscodilation with heavy viscoelastics. Coming to the most important technique, intracameral epinephrine, this improves iris tone by overcoming the adrenergic block. Dilute epinephrine with BSS in 1:3 ratio. Preservative-free epinephrine is used to eliminate endothelial toxicity. Adding epinephrine in the irrigation bottle is also useful in managing floppy iris syndrome. Episugarcane is a mixture of epinephrine, lidocaine, and BSS+. This is also helpful in managing these cases. In this video, you can see intracameral phenylephrine used to dilate pupil. Here it is used to facilitate cortical aspiration. Low fluid parameters will reduce turbulence in the AC, which will decrease billowing of the iris. In this video, neophysiological intraocular pressure is controlling floppy iris, you can see the IOP kept as 30, and even the aspiration flow rate are at higher level, maximum level. If you can keep IOP at a lower level, even higher other parameters may not affect you. Coming to iris retractors. In extreme cases of floppy iris, you can use iris retractors. Here, there is no risk of mid-procedure meiosis, but you have to make extra incisions, and it increases the surgical time. The retractors may be arranged in a diamond configuration. That is, one retractor should be below the iris or very close to the, below the tunnel or very close to the tunnel, so that it will prevent iris prolapse through tunnel. But rings may not be so ideal for floppy iris because it can get peripheral iris prolapse, and you may get some bilobing of the iris. So to conclude, preoperative screening is the most important step. Increased lens thickness and decreased mydriatic pupil diameter were associated with increased risk of floppy iris. And intracameral epinephrine is the useful technique for the management of floppy iris. Thank you very much.
Thank you, Dr. Jason, for that excellent talk on IFIS management of cataract.